I'm still out in Benzing. I'm here to present a condensed version of the Stop the Bleed. This is a national public service campaign that's sponsored by the American College of Surgeons and the Department of Homeland Security. Now, this is normally a 1-hour training, but we're going to cover it in 5 minutes. Think of this training as kind of CPR for hemorrhaging. Its purpose is to train anyone, any layperson, to be a first responder in order to stabilize the critically hemorrhaging patient to keep them alive until they can reach more definitive care. Now, it's always important to remember your primary principles. First and foremost is your own safety, and then recall the ABCs of bleeding. A stands for alert, call 911. B for bleeding, find the injury. And C, your strategies of compression, pressure, tourniquet, and packing. A, of course, alert means getting the help that you're going to need. Call 911 or have someone else call 911 for you. And of course, if you're in a medical setting, get the extra help, extra hands that you're going to need to help you. So when it comes to B for bleeding, location is important for management. Arm and leg wounds will be best controlled with strategies of direct pressure or applying a tourniquet, which we'll discuss later. In terms of torso or junctional wounds, located at the neck, the axilla, or the groin, these will best be controlled with strategies of direct pressure and wound packing. When it comes to chest and abdominal injuries, of course, these result in internal bleeding, which cannot be managed in the field. All of these patients require immediate transfer to a medical facility. When it comes to C, our first strategy for compression is direct pressure. Apply direct, continuous pressure with both hands over the top of the wound. Push down as hard as you can, and hold that pressure until help arrives. Next, we'll discuss the tourniquet. This is a device that we apply in order to stop the distal flow of blood, in order to stop and prevent the hemorrhaging. If applied correctly, it saves lives and can save limbs. Now, there are numerous commercial devices available. Most likely, you won't have those at your disposal. In that event, you may need to utilize and make your own makeshift tourniquet. There are 3 components to every tourniquet. The first of which is a strap, which in the field you can use a tie, a belt, a purse strap, a scarf, anything you have at your availability. The next is a windlass, which is then used to apply pressure and tighten it down over the limb. And then finally, you need a mechanism for tying it down once it's tightened. You apply a tourniquet as soon as you identify any life-threatening bleed from an individual's extremities, either an arm or a leg. You can place it over clothing if necessary, and ideal placement is 2 to 3 inches above the bleeding wound or proximal to the body. You then tighten the tourniquet until the bleeding stops. This will hurt. Warn the person. If it's hurting, that means it's working. And then if that's insufficient to stop the bleeding, you can apply an additional tourniquet, preferably more proximal to the first one that you placed. Now, the don'ts. You do not apply a tourniquet over the joints. You do not apply directly over pockets or bulky items. And you never loosen or remove a tourniquet once it's placed. A tourniquet can safely be left in place for up to 2 hours. Our last strategy is wound packing. The first goal is to expose the wound and locate the source of the most active bleeding. We then pack the wound with what we have best available. Hemostatic dressing is ideal, however gauze roll or even clean cloth is as available. We then stuff that into the wound. Note that based on the depiction on the illustration, it is not placed above the wound, but you're inserting it with your hand into the wound. Once the packing is placed, you then hold direct pressure until you're relieved by medical responders and you're able to transport the patient for more definitive care. If, however, after packing you're still noting additional bleeding, you can pack additional gauze or cloth over the original placement and reapply pressure with increased force. So in summary, first and foremost, ensure your own safety. Then remember the ABCs of bleeding. A, alert, call for help. B, bleeding, locate the source of bleeding. C, compression, 3 strategies, pressure, tourniquet, or packing. The only thing more tragic than a death is a death that could have been prevented. And now, in less than 5 minutes, you've all been armed with the basic knowledge to do just that. All you need to do is stay calm, stay safe, and remember your ABCs. For further information and to inquire about becoming a community Stop the Bleed instructor, please visit the website bleedingcontrol.org. Thank you.
Thank you, Adam. Mark Courtney, you're up next, and then judges, if you have any feedback for Adam on that presentation.
So thank you for the excellent presentation. Many public health messages for emergency conditions such as AEDs or the FAST mnemonic for stroke, hands-only CPR, do see some uptake in the community in general. This, at least from my experience, and I work in Detroit, so we see a lot of bleeding, it's just not out there. Do you have any idea why, and more importantly, like how do we get this out there to be in the same level as the other emergency interventions that are working in the community?